morning, everybody. So, we are going to go over the winner of the poll vote that we had last week up, requesting, who wanted to learn about what kind of topic for the week. And the winner of this week was the blood supply to the heart. So, we're going to be talking about that today. So just wanted to give you a little bit of a start, kind of giving you a little bit of anatomy of the heart, just so you kind of know what we're talking about, where we're talking about, and that sort of thing. So you can see here I have all the different valves of the heart labeled for you. You've got the tricuspid valve. That is the valve going between the right atrium and the right ventricle. Then you have the pulmonary valve that's going from the right ventricle out to the pulmonary arteries that take blood to the lungs to be oxygenated. Then you have the left atrium, which is going to receive blood back from the lungs. And you've got the mitral valve between the left atrium and the left ventricle. And then you've got the aortic valve, which is between the left ventricle and the aorta that takes blood out to the body. So also just to give you a little bit of a reference point as far as this goes, you're going to see a few anatomical terms as far as directions in the body. So we'll get to that here in just a moment. So you'll see here you've got the superior vena cava. Superior basically just means towards the top or towards the head. And then you've also got labeled here at the bottom the inferior vena cava. Inferior means towards the bottom or towards your feet. Then you've also got some other terms you'll see towards anterior, which is towards the chest, towards the front, or towards your sternum as far as the heart side goes. And posterior is going to be towards the back or towards your spine side of things. Okay. So just wanted to kind of go over those things with you here. So let's talk a little bit about how the blood flows through the heart. So during diastole, this is the relaxation phase of the cardiac cycle. And in this phase, you have all four chambers of the heart completely relaxed, allowing the heart to fill with blood. And this is basically blood returning from the body with deoxygenated blood from the systemic circulation, as well as, and that's coming into the right atrium, as well as oxygenated blood from the lungs that is coming into the left atrium. And blood returning from the body really just passively flows into the atrium due to pressure differences. And as the atria fill, come back there. And as the atria fill up with blood, the pressure within them starts to rise. And this pressure increase is going to cause also, along with a relaxation of the valves, the atrioventricular valves, which is your tricuspid valve on the right and the mitral valve on the left. This allows some of that blood to already start to flow down into the ventricles. And then you have the systole part of things. Okay, so that diastole part of things, everything is at rest. All right, so starting systole, this is the contraction phase of the cardiac cycle. Okay, and as you go into this phase, blood has already started to go from the atria into the ventricles just based on those changes in pressure within the heart. But in this particular phase, the atria contract and then the ventricles contract in a very specific sequence. So when you're listening to the heart with a stethoscope, you're actually going to hear that, characteristic lub-dub sort of sound of the heart as it beats, right? That first sound is the atria contracting. Okay, that's going to be that the lub sound of your heartbeat, that first sound. All right, and as that atria contracts, what that does is it pushes all of the rest of the blood that is still in the atria down through those valves into the ventricles. So on the right side, you're talking about through the tricuspid valve, and on the left side of the heart, you're talking about through the mitral valve. And again, that's the lub sound of the heartbeat. Then, following your atrial contraction, you've got the ventricles contracting with a much greater force than what the atria contract at. And this is going to be that dub sound, that second sound of your heartbeat. And as the ventricles contract, they squish and squeeze all that blood out of the ventricles and force, with a lot of pressure, force the blood out through the pulmonary valve as well as the aortic valve. And, as they squeeze, it increases that pressure, which is what's causing those valves to be forced open. And once the ventricles have ejected the majority of the blood that's in them, they begin to start to relax, and then the whole thing starts over. Okay, so let's get into the actual blood supply of the heart. So the coronary arteries originate from really a pretty strategic location, just above the aortic valve in the aorta when the blood is very first emerging from the left ventricle. So the heart itself is going to be the very first thing that gets oxygenated blood supply to it, right? Because obviously if your heart's not doing what it's supposed to do, the rest of the body doesn't, really worry about the rest of the body because nothing else is going to work, right? So the heart getting its own oxygenated blood is going to be first and foremost, all right? So the placement here really ensures that the heart receives that nice, fresh, oxygenated blood as soon as it leaves the ventricle. From this point, you've got pretty much an immediate branch, two major coronary arteries. So the first one is going to be on the left side of your screen here. This is the right coronary artery. And so when you're looking at this, this is as if you are standing in front of me looking at my chest. So the left side of the screen is going to be my right side of my body, and the right side of the screen is going to be the left side of my body. And so with your right coronary artery, also labeled a lot of the times in medical records as the RCA, this is going to be the major branch to the right side of the heart. And the right coronary artery travels along a groove kind of between the atria and the ventricle on the surface of the heart called the atrioventricular sulcus. And off of the right coronary artery, we have a few different branches. So you've got the right marginal arteries, and these are going to be a series of smaller arteries that supply blood to the outer right wall of the right ventricle. And then you've also got the posterior interventricular artery, also sometimes called the posterior descending artery or the PDA. You might see it labeled that way. This branch wraps around the side of the heart and travels along the back wall of the heart and supplies blood to that area, the back wall of the heart, okay? Often extending down towards the apex of the heart, which you can see labeled here on the right bottom side of your screen. So it's going to be like kind of the bottom point of the heart. In some people, though, the PDA is a pretty dominant vessel arising off of the RCA, and it does supply a pretty large portion of the inferior wall. The second main artery coming off of that initial branch is going to be the left coronary artery. So the left coronary artery really very quickly splits into two main key arteries, and that's going to be your left circumflex artery, which wraps around the left side of the heart to supply blood to that left wall of the heart. And then you've also got your left anterior descending artery, your LAD. Now pay very close attention to this one in particular. This one is often referred to as the widowmaker artery, okay? So this one is going to be a pretty crucial supplier of blood to the heart. It delivers blood to a very large portion of the front wall of the left ventricle in particular. And this is going to be the heart's strongest pumping chamber. So a blockage in this particular artery can really have serious consequences, hence the name widowmaker. Now, it's not 100% of the time that if you do have a blockage there, causing a heart attack, that it will be fatal, but it is a very high percentage of the time, but not 100%. And if you don't die from a heart attack in that particular vessel, you are a very lucky person. The other option, the other artery that we're going to talk about here is your left marginal artery. And this is similar to the right marginal arteries. They're going to be smaller branches that arise off of that left circumflex artery, and it supplies blood to the left ventricle's outer lateral wall, which is the side wall. We also have the diagonal branches. These are going to be some smaller branches that come off of the LAD and go kind of diagonally towards across the front wall of the left ventricle towards the bottom. And it is important to note that the exact branching of all of these arteries can definitely vary from person to person. There are sometimes slight anatomical differences from person to person, but this is just like your general textbook. This is where things should be, okay? Now, like I said, where it comes for you, this is not a strict blueprint exactly where everything lays. This is just in general, on average, for the average person, this is where things are going to be. But gaining that understanding of that general layout really kind of gives you a good picture of how blood actually reaches the different regions of the heart. So if you guys do have any questions about any of that, please do let me know. You can post the questions down here in the comments. You can also send me a message if that's more comfortable for you. I've had multiple people ask me if they can send me a message. That's perfectly fine. No need to ask to send me a message. You absolutely can. Do just make sure you comment to let me know that you have sent me a message, just so that I know to be looking for it, because a lot of times if we're not friends on Facebook, those messages either go to a message request box or into like a spam folder for me. So I may not end up seeing it for several days. I do try to check that regularly just to make sure, but sometimes they're missed. So if you do want to send me a message, no problem at all. You don't need to ask me permission, but just comment, let me know that you did send me a message so that I can be sure to look for it. If you guys do have any questions at all whatsoever, please do let me know. Otherwise, I will see you guys over in the group.